The Center for Collaborative Solutions was created to unleash the power of people working together to achieve common goals. We wanted to strengthen and develop the capacity of public-private partnerships to address complex issues and create change. Beginning in 1991, we focused on interest-based negotiation and problem-solving, successfully bringing public education stakeholders together to find common ground. In 1999, we began supporting the growing number of publicly funded after-school programs in low-income communities and became a nationally recognized leader in program, partnership, and policy development. 5 years later, we launched the Healthy Behaviors Initiative, known as HBI. Through this initiative, we promoted the development of programs and partnerships that are both changing and saving lives throughout California. Since 2007, our California Education Coalition for Healthcare Reform, or CHECR initiative, has brought all major statewide public education, management, and labor organizations together to improve healthcare quality and reduce costs for California's 1.75 million public school employees and their families. Our Healthy Behaviors Initiative, or HBI, has demonstrated that after-school programs can improve the eating habits and increase the physical activity of our most vulnerable children. These programs help to strengthen the food security of their families, change environments of high-poverty communities, and ensure that children are healthy, fit, and ready to learn. We know that this can be done cost-effectively by building on the existing public funding of after-school programs. Our goal is to take this initiative to scale in California and beyond over the next 8 years at a cost of $15 million. Our CHECR initiative has the dual goal of improving the health and well-being of public education staff members and their families, and reducing the cost of health benefits. We have a solid record of achieving results and are seeking funding to take this work to scale via establishing and strengthening large, statewide risk pools, training and supporting individual school districts to be wise purchasers of health benefits, and seeking funding for our new health promotion initiative created in partnership with Stanford University Medical Center. With exceptional experience in creating public-private partnerships, developing exemplary practices for after-school programs, leading learning communities, and creating learning centers, we're uniquely positioned to move to the next level. The return on investments and the impact on children, families, and communities have exceeded expectations. We have strong relationships with state and national leaders who are eager to join us in this effort. The key strength of CHECR is the powerful coalition of school and community college boards and administrators and all of their major unions. These groups work remarkably well together to create change. The coalition has established a track record of success, has become a highly respected voice in California, and is well poised to achieve even greater results with additional funding. We have a powerful vision of what could be, a passion for making a difference, and an unwavering commitment to finding innovative solutions to complex problems. We have deep knowledge of what works and a proven record of creating integrated approaches that result in significant social benefits and cost savings, and are replicable in diverse environments. Our approaches are fiscally sound, socially responsible, and politically attractive. We stay focused on the future and grounded in reality by studying the impact of what we've done. We listen to the individuals and organizations we work with and continually improve on what we do. We achieve this level of commitment and success by deploying knowledgeable and talented staff, consultants, and volunteers who have the skills needed to create success. Our strategies include training, coaching, mentoring, facilitation, learning community leadership, and advocacy. We measure our success by the success of the people and organizations we work with. 14 members of our statewide Healthy Behaviors learning communities have become learning centers, with 14 more slated to reach this level soon. As world-class learning labs, these comprehensive, multi-site after-school programs are systematically improving the health and well-being of thousands of students and their families, and have the capacity to reach hundreds of thousands more over the next decade. Checker successes are shown in the improvements in practice that school districts have made in their health benefit strategies, with documented savings in some districts reaching as much as $14 million as a result of our training and support. We've also done major work toward the establishment of a statewide public education risk pool. We published a white paper that gained statewide support and have worked with existing risk pools, health plans, and providers to achieve quality improvements. Our commitment to servant leadership as individuals and as an organization means that we place much more emphasis on building the capacity of others to succeed than on shining light on our own work. As a result, there are many who know of and have greatly benefited by our work, but may not know that CCS is the organization that's making it all happen. Our checker and interest-based work is well known in California's education community, but not as widely known in other sectors for the difference it's making in the lives of families and communities throughout our state. CCS is a clear leader in after-school program, partnership, and policy development. We're a pioneer in developing exemplary practices that have contributed to the quality and sustainability of these programs and led to significant improvement in students' academic performance, social skills, and health. Members of our team played a key role in California's first after-school legislation, which led to $550 million in annual funding and have supported hundreds of programs that have made a difference in the lives of hundreds of thousands of students and their families in high-poverty communities. HBI has helped transform the policy and practice landscape in preventing childhood obesity and improving the health and well-being of our children. Our publications, including Developing Exemplary Practices in After-School Programs, Expand and Excel, Lessons in Leadership, and Changing Lives, Saving Lives, are among the most widely read in the field. Our team includes keynote speakers and presenters at conferences all over the country, and this just touches the surface of the work we do every day in consulting, coaching, and mentoring programs, taking them to higher levels of quality and sustainability. Checker has brought management and labor stakeholders together to find common solutions to providing more affordable health benefits, save districts, teachers, administrators, and classified staff millions of dollars, and kept many school employees from being uninsured. We work in complex environments where organizations, and especially government entities, often operate in isolation from each other, compete rather than collaborate, and are more inclined to stay with the status quo rather than embrace needed change. Although we haven't been successful in every instance, we've broken through these barriers again and again by bringing the right people onto our team, being intentional and systematic in our approaches, and holding a strong vision of working with all stakeholders to co-create a better future. We've been successful in securing considerable funding in good economic times and vulnerable to undercapitalization in challenging times. California's government contracting processes have become increasingly complicated and unresponsive to performance timelines, which can be problematic. We're positioned to take our initiatives to scale in California and beyond by the end of the decade. Specifically, we would use additional resources to leverage and support the development of new regional or statewide healthy behaviors initiatives each year for several years, bringing the total number of learning centers in the United States to 200 by 2020. As they become operational, these new centers will have the capacity to support thousands of other after-school programs and impact the lives of millions of children, families, and communities. Checker has the neutrality, the expertise, and the partnerships to have much greater impact on the world of health benefits in the California public education system. Additional resources would allow us to create more training modules and provide training and follow-up services to a greater number of districts to ensure that they have the tools, strategies, and support they need to reduce their healthcare costs while improving the quality of care received. An additional $200,000 a year would allow us to make great strides in this direction. We know how important it is for there to be a next generation of champions that will continue, expand on, and strengthen our work. And we're committed to ensuring that this happens. While we expect that many of these future leaders will come from the ranks of the people we're already working with, we know that additional coaching and mentoring is critical in how successful they'll become. Our Checker initiative is positioned to become a leader in reforming the cost and quality of health benefits in California. Moving to the next level will require filling the gaps that exist in making this information and support more widely available to a larger audience.